Assalamualaikum. Welcome to Medix channel. Today we will discuss about internal medicine OSPE, and I have made 5 internal medicine OSPE stations that will be helpful for final year MBBS because there are 14 stations there. 10 stations are UL stations and 5 stations are 4 to 5 stations are interactive stations. Station number 1, there is X-ray. Describe the X-ray chest and what are the causes of this condition and what is the management of this condition. So the answer of first is describe the chest X-ray, and we will describe the chest X-ray findings. There is a homogeneous opacification here. There is homogeneous opacification in the right lower zone, as you have seen in the chest X-ray, with the opacity seen to track along the lateral chest wall. The right costophrenic angle is obliterated with the meniscus noted. This one is obliterated. Findings are suggestive of right-sided pleural effusion. So, what will be the causes of this condition, pleural effusion? There are two types of it, transudate and exudate. As we all know that transudate have less cells and less protein, and exudate have more cells and more protein. So the question is about the causes. Causes of transudate are congestive heart failure or CCF, cirrhosis of liver, nephrotic syndrome, and hypoproteinemia or hypoalbuminemia. The causes of exudate are infections like TB, malignancy, collagen disorders like SLE, Meigs syndrome, and drug induced. Third question was, what is the management of this condition, pleural effusion? The treatment is aimed at the underlying cause. These are the causes, and we will treat the cause, and tracheocentesis is done to remove the fluid and relieve the dyspnea or the shortness of breath of the patient. Second station, describe this ECG. What are the causes of these conditions that is depicted by this ECG, and how will you treat this condition? As you are seeing the ECG pattern, this is chaotic, irregular deflections of varying amplitude. There is no identifiable P waves, QRS complexes, and T waves. So the diagnosis of this ECG pattern is ventricular fibrillation because there is no pattern of P waves, QRS complex, or the T waves. What are the causes of this condition or ventricular fibrillation? VFib. Myocardial ischemia or infection is the most common cause of this condition. Other causes are cardiomyopathy, channelopathies like long QT syndrome, aortic stenosis, and aortic dissection are the main causes of VFib. How will you treat this condition? The main management is immediate defibrillation and CPR. If VFib persists after defibrillation, then continuous CPR. Intubation is indicated, and we will give epinephrine during this. Other options are drugs like IV amiodarone followed by shock, or other alternatives of IV amiodarone are lidocaine, magnesium, and procainamide. Third station is, a young female is admitted in the medical ward with a history of high-grade intermittent fever. Her blood film reveals Plasmodium falciparum. What are the other types of Plasmodium? What urinary abnormality may occur in the malaria? What are the various complications of malarial infection? And give 2 pharmacological treatments of this condition. So first question was, what are other types of Plasmodium besides Plasmodium falciparum, Plasmodium vivax, Plasmodium ovale? These are the 2 hypnocytes form, Plasmodium malariae and Plasmodium knowlesi. What urinary abnormality may occur in malaria? This is called black water fever because of the hemolysis. What are various complications of malarial infection? C question. Cerebral malaria, hypoglycemia, renal impairment, liver dysfunction. Algae malaria are various complications, but the most important of that is cerebral malaria. Fourth question, give two pharmacological treatments. As we all know that there is chloroquine plus primaquine, artesunate or artemether, and there is quinine salt plus doxycycline. These are various pharmacological drugs used in the condition Plasmodium falciparum or chloroquine resistant Plasmodium falciparum. So four stations I have chosen as the interactive station. While working in medical ward, you got an accidental needle prick injury while drawing blood samples from a patient with known HBV positive status. How will you manage this condition? So the answer is site should be immediately washed with soap and water. Incident should be reported to the authorities and exposure should be assessed and evaluated according to the protocols, and appropriate treatment of the positive exposure should be given. Regardless of the status, if individual is pricked and unvaccinated, the vaccination should be initiated. If pricked and documented to have vaccine response, then no treatment is given. If vaccination status is unknown of the patient, then he should be tested for anti-HBs before deciding on treatment. So the fifth station is Yule station. Given a pic, what is the finding in this picture? What is the diagnosis of this condition? And what are other signs in these conditions? So according to picture, these are discrete red areas overlying the knuckles in a person with juvenile dermatomyositis. So the condition is dermatomyositis, and these are on the knuckles Gordon's papules. So what is the diagnosis and what are other signs of these conditions? Gordon, I have already told you juvenile dermatomyositis, and what are other signs? Mechanic's hands, helitoprash, shawl sign, V sign, and Hollister sign. And what are various investigations used for this condition, juvenile dermatomyositis? Most important of this is serum CK and aldolase. These both are enzymes are increased in this condition, and also there is increased ESR, CRP, and leukocytosis, increased TLC count, anti-Jovan antibodies, electromyography, muscle biopsy, and skin biopsy. These are various conditions. These are various investigations used for this condition, juvenile dermatomyositis. Thank you for listening. These are 5 internal medicine stations, and I have made this channel MedDis on the YouTube, and I have also made OSPES King named page on Facebook, where I will upload various OSPEs of first year MBBS to final year MBBS, and I will upload all the OSPEs in Word form and in PowerPoint form. And on MedDesk YouTube channel, I will upload many stations from first year MBBS to final year MBBS. Like I have given this lecture of 5 internal medicine stations. These auspice stations are very important in MBBS, um, because many of the students gets fail because of these stations. Due to panic, they don't remember the answers, and in result they fail their examinations. So I will try my best to provide you many material, almost the complete data about these OSPEs and these OSCEs of all the subjects during your whole MBBS. Thank you, and subscribe and like this channel. Thank you. Allah Hafiz.